Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. So, as we know, we were discussing about different aspects of basics of genetics. In that context, in the last class, we were discussing about autosomal dominant disorders. And among the autosomal dominant disorders, we are looking into the concept of penetrance, and for which we have given two important examples, and one example is that of the Marfan syndrome and another example is that of a familial hypercholesterolemia. Now in this class we will discuss one more important property of autosomal dominant disorders, and that is called as pleiotrophy. What you mean by pleiotrophy? Pleiotrophy is also commonly seen in autosomal dominant disorders, just like penetrance. Now, pleiotrophy means the defect in one gene can produce the symptoms in multiple systems. Suppose one gene is defective and that gene is producing some proteins responsible for the production of some protein, and that protein is utilized in the body, in the different parts of the body, for the formation of different structures. So in such cases, when that particular protein is absent, multiple systems of the body are get affected, and that leads to multi-system involvement. For example, you take the example of Marfan syndrome. Marfan syndrome, there is problem in chromosome number 15, and the gene which is present in the chromosome number 15 is responsible for formation of a protein which is called as fibrillin. This fibrillin is very important for the formation of the elastic tissues and also collagen tissues. Okay, now what are all the body portions are there, body structures are there where elastin is required or where the elastic tissues are formed, all those body portions are get affected because of absence of this one particular single protein. Okay, so basically if you talk about Marfan syndrome where there is fibrillin absent, then three basic systems are get affected. Number one is CVS, cardiovascular system. In the cardiovascular system, the big vessels are there. These big vessels are made of so many elastic tissue for the contractibility and relaxability. There should be some elastic tissues, especially in the pulmonary trunk and as well as aorta, etc. Now, if this elastic tissue is not formed because of the absence of the protein called as fibrillin, then heart valves are badly affected, or bigger vessels of the heart are get affected. Therefore, a Marfan syndrome most of the time always produce a cardiovascular system symptom. There is also involvement of cardiovascular system. Murmurs will be there or some other problems will be there. Similarly, this particular fibrillin which is forming the elastin is also required for the formation of the skeletal tissues. So therefore, there will be abnormality of the skeletal system in the Marfan syndrome, and patient will have a long body, height is more, disproportionate to fingers, and long fingernails, slender fingernails. Okay, upper segment, lower segment ratio is get affected, arm length is more than the height. So like the different abnormal variations related to the skeletal system will be formed. Similarly, the elastic tissues and this particular fibrillin is also required for the formation of the suspensory ligaments of the lens of the eyeball in the visual system. So there is also effect to the lens, ocular system is get affected, eyes and lens. So now we know that single absence of fibrillin is responsible for formation of the symptoms related to three important systems: visual system, skeletal system, and as well as a cardiovascular system. So this is called as pleiometry. Pleo means more. Pleiometry. Okay. Abnormalities are seen in multiple phenotypes of the body due to one defective gene. So if you put all the Marfans together, suppose, and then we can find the many will have only the visual symptoms. Suppose you take 100 Marfan syndrome patients. Out of them, many will have only the visual system problem. Many will have only the skeletal system problem, many will have only cardiovascular problem, and few may have all the three systems involvement. Okay, so now this is called as pleiometry. Therefore, in autosomal dominant disorders, always multiple systems are get affected, or Any one system can be get affected depending upon the severity of the mutant gene. Okay, and this particular thing is aspect is called as pleiometry. If you want to take an example of osteogenesis imperfecta, another example, osteogenesis imperfecta is again a skeletal problem, but actually the problem is with the collagen tissues. Okay, there is abnormality in the formation of the collagen tissue. One particular protein which is required for the formation of the collagen tissue is genetically absent because of the dominant gene problem. Okay, now this collagen tissue problem may be seen in two parts. One is in the bone. We know that osteogenesis imperfecta, always there will be bone problem and there will be pathological fractures. Everything is taking place. Another problem is there may be blue sclera. There may be also blue sclera. So there will be chances of pathological fracture, and there is also chances of formation of the ocular symptoms. Okay, so one single gene problem, one single protein is deficient, but in two different systems you find the symptoms. This is another example of a pleiotropism. So these are the pictures of osteogenesis imperfecta. Another important nature of autosomal dominant trait is variable expressibility. Okay, we have seen the penetrance, low penetrance, high penetrance. Then there is no skipping of the generations. Then we have seen the pleiotrophy. Now look into variable expressibility. What do you mean by variable expressibility? Now, different patients of one autosomal dominant disorders may express different severity of the disorders at different onset of age. Now, this is another important thing in autosomal dominant disorders. What happens? At different, the symptoms may be presented at the different age. Symptom may be present with a different severity. Different patients of one autosomal dominant disorder, for example, to take Marfan syndrome, one autosomal disorder may express the different severity. Suppose out of the three systems in Marfan syndrome, if only one system is get affected, he is not having much severity. Suppose he is having only bony problem and he don't have the cardiovascular problem, then severity will be less. Although he is looking abnormal, the severity is less. If he is not having the visual problems and only bone problem is there, then severity is less. Or the other two systems are not involved, for example, not much severe, but the CVS is more, then patient will have more symptoms, because CVS is a very important symptom. So if we take 10 patients of Marfan syndrome, all will not have the same severity of the symptoms at the same age of onset and same clinical problems. Okay, so this is called as variable expression or variable expressibility. The bone problems will be more problematic, so maybe even after 20 years. But cardiovascular system problems may be identified as early as 1 or 2 years. Age of onset, he is now only 2 years. But only bone problem is there, cardiovascular problem is not there. Maybe the symptoms start. In the childhood period, the bone grows and the height is increasing. Everybody is happy maybe. But after 20 years, there may be some problem. Age of onset of expression of the symptoms is more now. So this is called as variable expressibility, and this is one more important aspect in autosomal dominant disorder. Whenever there is autosomal dominant traits, so you will see this particular type of presentation. Okay, next. Another important concept in case of autosomal dominant disorder is new mutation. Okay, what do you mean by new mutation? Now, previously there is no problem in the family, but suddenly a problem can start in that family. This is possible in case of autosomal dominant disorders. If you look into 10 families previously, there is no disease of dominant trait. Okay, there is no dominant disorder. But from this particular family, the problem can now start. How it is possible? Yes, this is. Again, you take the example of Marfan syndrome. Okay, I will show the pedigree also. Again, you take the example of Marfan syndrome. There is one child develops Marfan syndrome, but there is no family history of Marfan syndrome anywhere since last 4 or 5 generations. You take this history. Okay, now there may be one baby here. or see 3 or 4, 1, 2, 3 families, 2 of the families are not having the disease. This is against the rule of dominant disorder, isn't it? In the dominant disorder, there is no skipping of the generation, but there is a skipping of the generation. I have only shown 2 generations. You can take 4 or 5 generations. There is skipping of the generation. But after few generations, again the child started with the Marfan syndrome. One of the baby developed the Marfan syndrome. Now, when you ask the question for this, why this is happening, then this is called as because of new mutation. Now, let us see what is this new mutation. Now, in the Marfan syndrome is there, but there is no history of Marfan syndrome since the last 4 to 5 generation. Now, this is probably because the new mutations are developed. Okay, all the previous generation were normal, but one baby in the next present generation has suddenly developed the Marfan syndrome. The most common cause is development of new mutation. Okay, so when it is due to new mutation, how to identify this? Isn't it? Suddenly it is coming. So genetically, when you are doing the screening, how you are going to identify it? Suddenly some changes has been taken place in the dominant gene and it becomes mutant. And thereafter the disease continues in the next generation. Okay. Now, but whether it is because of new mutation or whether it is because of low penetrance or some other causes, how you go into identify? See, that is very easy. When there is a new mutation, the development of the disease is in the other baby of the same generation is almost all 0, and it will not be equal to male and female ratio. We know that. You look into this picture. Okay, we know that. What are the basic rules? Basic rules of autosomal dominant disorder is male and female ratio is equal. In the disease are also 50% male, 50% female, and there is no skipping of the generation. But there is skipping of the generation in this case. New mutation happened. But what are the other 2 rules? Male and female ratio should be normal. If you see here, male and female ratio is not normal, isn't it? One of the male is affected and one of the female is not affected. Okay, one of the female is not affected. She is not diseased. And male and female ratio is also not equal. Only males are affected. So that means only the mutation has taken place in this particular gamete. Okay, only the gamete of this particular child, that particular gene has undergone some mutation. So you can identify the cases of new mutation by this, where in case of new mutation, it will not follow the other rules of dominant inheritance. The dominant inheritance always will have male and female ratio equal. 50% males, 50% females are affected, and there is no skipping of the generation. Of course, skipping of the generation is here, that is creating the confusion. But other 2 rules, male and female ratio and R, so that helps to identify that yes, this is not a routine autosomal dominant inheritance. This is a new mutation case. You just understand, new mutation means everything is normal at the time of the embryogenesis, or because of some lifestyle modifications or abnormal lifestyle, etc., only in that particular gamete the change has been taken place. Not in all. Male and female, both fathers are normal. But when these fathers are going to mate, that time the male gamete and female gamete which is coming, probably from the one gamete, okay, this particular gene, you take female, the female gamete, okay, the gene which is located in this particular chromosome number 15, so that has undergone some mutation, some change, and that leads to the disease. It is not happening in all the gametes, okay, or every time. It is not happening in the other gametes. So therefore other kids are normal. Only the problem in this kid. So that is how you have to identify the mutation cases. Now, the last one, or one more important thing, which is about the autosomal dominant disorder, is parental aging. Okay, parental aging is very important. Now, very interesting finding was seen. This can be explained with the example of achondroplasia. Achondroplasia is one of the autosomal dominant condition. Autosomal dominant condition. You have been seen the short achondroplasia, short limb dwarfism. Okay. So now this can be explained by the example of achondroplasia. Now what happens? This can also occur in new mutation in structural gene problem. Now, achondroplasia is an autosomal dominant disorder, and this is due to the mutant gene responsible for the formation of a FBF, that means a fibroblast factor R3. Okay, the gene name is a fibroblast factor R3, and that particular R3 gene of fibroblast factor R3, FBFR3, is abnormal. Okay, in case of a achondroplasia. For the growth, we need cartilaginous tissue. For the growth of the bones, we need the cartilaginous tissue, and especially for the formation of this cartilaginous tissue, this particular fibroblast, this particular the protein which is produced from this fibroblast, that is very, very important, and that is missing here, and as a result bone growth will not be proper, and as a result we know that there is dwarfism in case of achondroplasia. Okay, because what happens is, as the growth plate fuses early, because of absence of this cartilaginous tissue or whatever the factor which is required, the growth plate will go into fuse very early, and the limbs will be short. And with the other parts of all the other parts of the body is normal, one limbs will be short, so they will have the disproportionate short stature or short limb, short stature. Okay, I think you got the point. Now this is one of the example what I am giving for the parental aging and autosomal dominant disorder. Now what happens in case of this parental aging or achondroplasia? If we take 100 cases of achondroplasia, most of them are reproductively unfit. In case of achondroplasia, most of them are reproductively unfit. They are not able to produce the offspring. Okay, that means what should happen in the due course of the time? The number of achondroplasia patients should decrease, isn't it? Suppose one achondroplasia patient is born and he has developed into the adulthood, but in the adulthood also he is not able to produce any kids. Okay, so reproductively he is unfit, so he is not producing any kids, means for the next generation disease is not going. Okay, what happens after 4 or 5 generations? What should happen in the due course of 200 years? What happens? What should happen? The number of achondroplasia cases should decrease, isn't it? But if you see, it is not happening. But actually it is not happening. So chance of that means the number is increasing. It is observed that the number of achondroplasia is increasing, not decreasing. Okay, so that means the chance of some new mutation is happening. Okay, the disease is manifesting because of some new mutation. So what was observed is, especially marrying an older man and getting a baby increases chance of mutant gene. Okay, so there is a new mutation is happening. Where this new mutation is happening? If a lady marries an old man, that means parental aging, parent. Okay, paternal side, father. Okay, father's age, if it is more, mother's age is less, then because of age factor, there may be some changes in the genes of the father. Okay, which is responsible for this particular gene. What is that? FBFR3 gene. That the chance of undergoing some changes in that gene is more, and probably that is producing the achondroplasia. Otherwise, as the patient is reproductively unfit, as the generation passes, number should decrease, but it is not happening. That is, advanced age of the father is also considered as one of the most important cause for the new mutations in case of achondroplasia. So paternal aging, that is also very important. Paternal aging, that means we know that if the age of the mother is more, chance of Down syndrome is more. Similarly, if the age of the father is more, there is chance of achondroplasia. So paternal age, paternal, not parental, paternal age is one of the important factor for the. So this is another important thing with the autosomal dominant disorder. So if the paternal age is more, and then you are getting some issues for babies, okay, chance of development of achondroplasia is more. This is one more important aspect related to autosomal dominant disorders, and this is the case of that. Now there is one more possibility in autosomal dominant disorders. There is one more possibility. What is that? This is quite interesting. Okay, you take this example. Now suppose you are taking a Morphon's baby. Okay, the lady is Morphon's lady, and the boy is also Morphon's boy. Now this Morphon girl is usually long, isn't it? Height is more. So parents are searching for a boy who is also having very good height, equal to that of the female. Usually in the society we will have this tendency, female male height should be little bit should be more than the female height, otherwise it looks abnormal, like that. Now here female height is already more, so they are searching for a male who is having more height than the female. So fortunately they get a Morphon boy. Lady is also having a more height, okay, because she is a Morphon's lady. Now they also get a Morphon boy. Now parents were very happy, both the parties, and they decided the marriage. So Morphon's boy marriage with the Morphon's girl. What happens? Both are having the mutant genes, isn't it? See here, the boy is also having mutant gene and girl is also having mutant gene. Now suppose if they have got 4 kids, out of these 4 kids, okay, if you do the permutation combination here, 3 kids will be get affected and 1 will be normal. These are the possibilities. Assessment, that's all. Possibility, prediction. Okay, genetics is all prediction. Okay, suppose if they have got only 1 kid, all our assessment goes wrong, isn't it? They decided we will have only 1 kid and that 1 kid was normal. Finish. Okay, if they decide for only 2 kids, 1 is normal, 1 is abnormal. Okay, or first kid may be itself abnormal. Any possibility is there. So this is about the prediction. We say that if the 4 kids are there, out of them if 2 are male or 2 are female, then our calculation goes. Okay, anyway, in this case now what happens? 3 are having the problem and 1 is normal. Okay, now see, this boy has received the mutant gene from both father and mother, and he is also having Morphon syndrome, this girl. And this girl received only from the father and not from the mother. And this boy received only from the mother and not from the father. Or from the father, there is no from the mother. And he received both the normal genes and therefore he is normal. Now how you can say here these 2 kids are having less penetrance because they have only 1 mutant gene. Therefore we will call it that they will have less penetrance. But this one who received the mutant gene from both father and mother, so he will have all the manifestations of Morphon syndrome. All the 3 manifestations of the Morphon syndrome. Okay, this child may even undergo abortion. Okay, because of high penetrance. So this is another important possibility when we look into the autosomal dominant disorders. And this is Morphon boy and Morphon girl. Now, what are some of the common autosomal disorders which we see in normal practice? Familial hypercholesteremia, hereditary non-polyposis colon cancer, polyposis of the colon, breast cancer, hereditary hemorrhagic telangiectasia, Morphon syndrome, hereditary spherocytosis, adult polycystic kidney disease, Huntington's chorea, acute intermittent porphyria, ontogenesis imperfecta, von Willebrand's disease, very important, myotonic dystrophy, familial hypercholesteremia, familial hypertrophic cardiomyopathy, neurofibromatosis, and tuberous sclerosis. These are some of the autosomal dominant disorders. Problem will be always there in the structure. Okay, then we know that what are the possibilities? 50-50 male-female ratio, among the disease also 50-50, no skip of generation, vertical transmission. Then 6 properties. There will be penetrance, high penetrance, low penetrance. Then there will be pleiometry. Then there will be variable expressibility. Then there will be new mutation. Then there is a paternal aging, and there will be Morphon to Morphon with the high penetrance and low penetrance. If Morphon girls marries with a Morphon boy. That's the example I have given. So this is all about autosomal dominant disorders in short. Okay, this is a basic part. If you try to understand, if you make this point clear, then now onwards you can read so many autosomal disorders easily and you will understand it. Okay, it is also easy to estimate to have an idea on the symptoms also. Okay, now see, autosomal dominant means there should be some structural problem. You find out that structural problem in the many part of the system. Some may be affected, some may not be affected. Okay, one which is severe, that will be early affected. One which is less severe, that will be manifested late. See, things are easy now. Okay, this is all about the basics of autosomal dominant disorders. In the next class, we will discuss about autosomal recessive disorders and its basics. Thank you very much. I hope you are enjoying, but don't forget to subscribe my channel, and also please give your valuable comments. We'll meet in the next class. Thank you very much.